And now we cross over to our Usuyang for a global insight and an in-depth look at important developments in world affairs.
Thanks very much, Morgan. It is indeed time for Global Insight. The United Kingdom, parts of the United States and countries in Europe have been scrapping their vaccine passports and much of their social distancing rules as their vaccination rates are high and hospitalisation rates have been falling. This has led to the question of whether the pandemic is nearing its end and transitioning towards becoming an endemic. Now, there are, of course, other parts of the world where the vaccine needs have not been met due to vaccine inequity. In the third year of the global pandemic, we discuss how the world is dealing with COVID-19, and for this, I'm joined by Bharat Pankania, Senior Clinical Lecturer at the University of Exeter's College of Medicine and Health. A very warm welcome back, Dr. Pankania. It's lovely to see you. And, well, there's quite a lot of talk of an endemic these days, the pandemic transitioning to an endemic. So firstly, how do we define the term endemic and what makes it different from a pandemic?
So a pandemic refers to an infection that affects all people. Pandemos affects all people. Endemic means it is there all the time. And in a situation whereby you either have a lot of people who are periodically infected and therefore infectious, it makes a disease circulate within a community, within a global community, and it's persistently there. That means it's endemic. So, for example, measles is endemic. We've always got measles. We are under control with measles because we immunize.
Well, what are the criterion that epidemiologists like yourself go by when determining whether or not a virus is at the endemic stage?
So when it moves from causing disease extensively in the world population and it stops infecting people because people are either immune because they've got the vaccine or they've had the infection and they are protected from further infections, but it then moves from that stage of having extensive number of cases, which is epidemic, to endemic, which means it is now in low level, but background cases still remain there. So it is at a lower level and you will get periodic outbreaks, but it is not there at a high level, which happens during the pandemic stage.
And of course, in the UK, where you are, all the restrictions are gone now. And, well, then how are you expecting the pattern of transmissions to look for COVID-19?
So if we wish to know what will happen in the UK, a good example would be Denmark, which a few weeks before the UK released all its restrictions as well. And the case numbers shot up in Denmark. And similarly, whilst we're entering spring and longer days, I expect also our case numbers to shoot up. And already we are noticing that our hospital admissions in March are greater than they were in January. So this pandemic is not over. Whilst we have removed restrictions because fewer people are dying, it doesn't mean the virus has gone away.
Well, most people seem to be taking comfort in the fact that Omicron is proving to be slightly milder than previous variants. And, well, do you think that Omicron is going to be the last COVID-19 variant, or is it possible that another significant variant could emerge?
So first things first, Omicron is not mild. The only reason why Omicron is mild is because the population has been extensively immunized and protected, and an Omicron infection in that group of people is not so severe. If you are not immunized at all, you can be severely ill even with Omicron. Furthermore, in answer to your question, is Omicron the last variant? Not at all. We can get a variant that is worse than Omicron, worse than Delta. On the other hand, we may get a variant which is mild disease causing, but we just don't know. Is it the end of variants? Definitely not.
And then, well, how long then we continue these protective measures then, if not enforced by the government, then on our own account? How long should we wear our masks for instance?
So one way to make it better globally is to immunize globally, because we are a global community now. It is impossible to say we are an island on our own, we don't worry about the rest of the world. When you immunize globally, what will happen is case numbers will go down. And when case numbers go down, unfortunately with SARS-CoV-2, it looks highly unlikely that we will ever eliminate it and it will become endemic. When it becomes endemic and it's low levels, at that stage, you can start to remove your restrictions. But at the same time, we need to be careful with elderly people, very vulnerable people who unfortunately remain vulnerable for a very long time. And for those sort of people, we should have preventative measures in place up front. And those preventative measures in place up front would be how to diagnose the infection very quickly, very soon in their infection, and then give to them antiviral drugs like Paxlovid as soon as possible. That will be the way forward in keeping elderly, vulnerable people safe when we go from the pandemic to the endemic stage.
And well, whether it's realistic or not, Europe and the US, there are discussions about the post-pandemic era, but at the same time, it's still a full-on pandemic for lower-income countries, which weren't able to access vaccines as easily. How much more severe is the impact of the pandemic in developing countries than it was for advanced economies?
The saving grace for the poorer economies is that the poorer economies also happen to have a younger population. And we do know that SARS-CoV-2 is less severe disease causing in the younger population. So if you take Africa, very young population, unimmunized, but they have fewer deaths. They have fewer deaths because Africa, they spend more time outdoors. And second thing, they have a younger population. Nevertheless, it has devastated their economies just as much as it has devastated Western, richer countries' economies.
And well, what kind of support and assistance do developing countries need right now?
Well, the good news is that we've got vaccines. And not only vaccines, but we've got enough vaccines for boosters in richer nations and vaccines to immunize countries that have not been immunized at all. So we've got the vaccines. But what is needed are the logistics, the needle, the syringe, the refrigeration, the IT, the logistics, the setting up of the clinics, the healthcare workers to give the vaccine, the communication, the advice to people that vaccines save your life and prevent you from severe illness. All that piece of work is needed so that as soon as possible, as fast as possible, we can immunize the continent of Africa and other parts of the world. Vaccines are available. We need the other armamentums to enable this to happen now.
And until now, vaccines have been targeting certain variants, but Dr. Anthony Fauci in the US wrote recently about the need for universal coronavirus vaccines. Now, how would these work and how plausible are they?
Oh, it is eminently plausible, and I'm sure research is going on right now as we speak. So how do I describe it for your listeners and viewers is as follows. The vaccines that we developed were against the spike protein. On the other hand, we could develop vaccines against other proteins on the virus. And if these other proteins do not keep on changing shape as often as the spike proteins do, then we have a successful universal vaccine which will carry on working even if the spike protein keeps on changing its shape. It is attacking a completely different protein in a different part of the virus, and therefore it works.
Well, in the future, if there is another major coronavirus outbreak, what do you hope to see done differently? Do you think future outbreaks could be isolated or prevented from turning into pandemics?
It's very difficult to do so if we have a highly virulent virus. But what we need to do is learn from our mistakes. And the biggest story is no one is well until everyone is well. The Western countries, the richer nations must learn that unless and until you immunize the whole world simultaneously, it's not going to work. What happened with America, European Union, United Kingdom was they selfishly immunized their population only. And then they've had to keep on giving them boosters and such interventions. Whereas if they had followed the World Health Organization pandemic outbreak control plan, they would have immunized everyone all over the world simultaneously, starting with vulnerable people and healthcare workers and essential workers, and work their way down. But what we're doing is bring it down gently across the globe. But of course, politics dictates that you immunize your own population and you don't worry about elsewhere, and that's a mistake.
And nowadays, of course, there are a lot of concerns about long COVID and the ramifications of that. And what are the symptoms that are common and that we should be on alert for?
Yes, well, long COVID is a really big worry. And I have been saying since the pandemic arose that the best thing anyone can do is don't get infected, don't infect others, and don't drop your guard. Because with long COVID, what it is a autoimmune reaction set into your own body after the infection has come and gone. And it affects the brain, affects the heart, and other organs. And only yesterday, a report was published in Nature journal, which said that people who have sudden loss of smell and taste have reduced cortical activity, meaning reduced brain size, reduced functionality of their brains. Therefore, in some people, long COVID is very real and very important, and we haven't got a cure for it. So the best advice I can give to anyone, anywhere is don't drop your guard, don't get infected, don't infect others, get your vaccines.
And finally, well, most of the attention has been on vaccines during this pandemic, but what about therapeutics? Have we seen major advances there?
Yes, we have, and it is really good of you to ask that question, because it is really pleasing that in a short time, less than 2 years, we invented a successful platform of vaccines. And then we also found that in people who needed oxygen support, early intervention with steroids was helpful and it stopped people from dying. And now we've also got several platforms of antiviral drugs. And this together is making a big difference. The antiviral drugs, the immunoglobulins, the steroids, and other drugs, as well as the vaccines, as well as better techniques for ventilating patients. All of this is reducing deaths. All of this is making it better, and soon we will go from the pandemic to the endemic stage.
Well, Dr. Pankanya, thank you so much for staying up for us. Your home is looking as lovely as ever. Well, that was Professor Bharat Pankanya, Senior Clinical Lecturer at the University of Exeter's College of Medicine and Health. Thank you again so much for your insights.
Thank you.